Today we are going to talk about psoriasis. Psoriasis is a chronic inflammatory and proliferative skin condition associated with systemic manifestations in many other organ systems. It is a chronic inflammatory skin condition that involves hyperproliferation of the keratinocytes in the epidermis with an increase in epidermal cell turnover rate. Most keratistic lesions consist of red scaly, sharply demarcated and indurated plaques present particularly on extensor surfaces and scalp with keratistic silvery scales. Onset and risk factors. Onset of psoriasis can be at any age, but peak ages ranges from 30 to 39 and 50 to 69 years of age. Risk factors include most common one is family history, smoking, alcohol use, medications like beta blockers, lithium and chloroquine, obesity, infections like HIV infection and post-streptococcal infection period, psychological stress and physical trauma site. Injury or irritation to normal skin tends to induce lesions of psoriasis at the site of trauma. Now, types of psoriasis. Plaque psoriasis is the most common form. Scalp, knees, elbows, and gluteal clefts are the most common sites of plaque psoriasis having symmetrical distribution. And Onset sign is positive. Onset sign refers to the appearance of small pinpoint bleeding after removal of scales from the psoriatic plaque. Second is guttate psoriasis. Guttate psoriasis is acute eruption preceded by streptococcal infection. Most common presentation is on trunk and proximal extremities. Pustular psoriasis is possibly life-threatening condition having sudden onset with association of leukocytosis, malaise, fever, hypocalcemia, and pregnancy is the risk factor. Erythrodermic psoriasis. Erythrodermic psoriasis can involve head to toe with generalized erythema or redness with dyschematic scales. Inverse psoriasis, it involves skin folds and having no visible scaling. Next type is nail psoriasis. Nail psoriasis is associated with psoriatic arthritis, and the findings of nail psoriasis are pitting of the nails, oil spots and distal onycholysis. Management of the psoriasis. Management is according to the disease severity. For mild to limited disease, topical applications of potent topical steroids, vitamin D analogs, coal tar, diethranol and emollient. And for severe disease, there are phototherapy options like local UVB or PUVA therapy, laser and acitretin, apremilast, cyclosporin, methotrexate and newer drugs like biological agents adalimumab, etanercept and infliximab.